My name is Dr. Rhoda Creek, and I am the CEO and founder of Amber Medical Clinics Limited, and I'm also the president of Amber Care Foundation. Amber is a private healthcare company that is tech-driven. We are a health and wellness company that was founded 7 years ago with the intention of providing quality, patient-centric care and using technology to deliver this in the most impactful and efficient way possible, of course in a resource-restricted setting that we operate in. I'm a medical doctor by profession. I have served as a leader in the public healthcare sector, where I have been a medical superintendent within the Ministry of Medical Services, Ministry of Health as it were now, as well as being a project director for an HIV program. And then I moved on to private healthcare. I worked with a private healthcare company and then decided to set up my own organization. I think inclusion is everything, because as a leader, you have to be able to bring out people's superpowers, but you cannot see or know those superpowers if they're not at the table with you. So simply giving a chance to people, even when they're diamonds in the rough, is extremely important. As an organization, we may skew the opposite way, which is we have so much more female employees than we do male, and it just happened by default. It happened because we were at the beginning so deliberate about giving female students and graduates a chance right off of university and training them. And as a startup, it made financial sense for us to train people right off the bat, so graduate trainees as it were. We then bought their loyalty through this, and that was our way of diving into inclusion. Giving people a chance who would otherwise be overlooked, just cracking the door open for them, giving them a chance to show off their superpowers. And it has paid off. It always pays off. So I would say being intentional with inclusion is everything. Inclusion in terms of having these voices at high levels, having female voices at the point of policy making, at the point of making financial decisions, at the point of resource allocation. And this is at each and every level, but even more important at high levels in our setting. Making sure that we don't have token females where we're just there in a leadership position to tick the inclusion box, but actually being included and being validated and being heard. Create your own space and then own it. Do not wait to be given a chance. Put your foot through the door, stick your nose in, and make some noise. And that then means there's a lot of opportunities for innovation now. Healthcare typically, nursing, medicine, laboratory work, pharmacy, we're very cookie cutter. When we get into various points of training, we often almost can tell you exactly how our career is going to go 10 years from now, 5 years from now, just because specialty training is very clear. And the jobs into which you'll be employed or absorbed into are also very clear. But I realized that what happens is then people with a non-healthcare background take up spaces that we really should be the ones to take up because we have a healthcare background. So aim to diversify your skill set, aim to diversify your networks, of course by doing things like the SBS programs, and then take up space. Once you take up that space, own it. One big challenge that I have had as a female leader has been having financial backing and having people trust that you do have lasting power and you will be here for the long haul. So sometimes you have to prove yourself a little more than your male colleagues might have to, but keep going. So own your space, create your space, and then own it.